I'm Dr. Greg Nelson, palliative medicine specialist with Dorothy Kurtz, certified palliative care nurse, speaking with you today about managing pain and other symptoms with opioid medication. Opioids are a group of drugs that have been around for many years and are usually prescribed for serious pain or shortness of breath. Perhaps you've been prescribed medications and treatments that really haven't helped. So today you're watching this educational video because your physician has recommended an opioid, hoping that you will feel and function better. The benefits of taking an opioid can be dramatic, but there can also be side effects. We hope through this video to lessen any fears you might have about taking opioid medications and to inform you of the risks. The more you understand, the more confidence you'll have in your doctor's plan.
This video was designed to accompany the form that you were given. Both contain important patient education. We ask that you watch the video and follow along with the form, initialing next to each statement showing that you agree and understand. Feel free to pause and refer to the form, but be sure and let your nurse know if you need more help. We care about you and we want to help you feel as good as possible. We know that severe, uncontrolled pain can cause a person to experience a poor quality of life. This can include problems sleeping, poor appetite, difficulty moving, leading to muscle weakness and fatigue. There can be emotional upset such as anxiety and depression. It can affect your relationships. Uncontrolled pain can make it difficult to carry out your responsibilities at work and at home. Another symptom that is often addressed and relieved with opioids is severe shortness of breath, also called dyspnea or air hunger. When a person struggles with this type of breathing issue, they often experience a poor quality of life similar to that of a person with uncontrolled pain. Opioids, when taken prior to an activity that brings on difficulty breathing, can really make a difference. Along with medication, your doctor might also recommend physical therapy, exercise, and counseling, or they may even refer you to another type of pain specialist who may offer therapies like injections or procedures. Treatment of pain and relieving shortness of breath will help you reach your personal goals, such as sleeping better, reducing fatigue, and exercising. For example, right now, you might be able to get around in your home. With better pain and symptom control, your goal might be to go outside, do some yard work, or take a walk. I need to mention that zero pain is not our goal. It's aiming for a pain level that helps you function better and enjoy your life. While I've discussed the benefits of good pain and symptom management, there's more you need to know.
On the form in front of you is a list of common and not so common side effects. An actual allergy to opioids is uncommon. I've had patients say to me, "A nurse at the hospital gave me morphine through my IV and I became sick to my stomach or possibly confused." What happens after an injection won't necessarily happen when you take it by mouth. Of the side effects listed on your form, constipation is the most common. The other side effects can occur, so read through them carefully. You and your family will need to watch for them and report back to the doctor if experienced. Sometimes additional medication will need to be prescribed to combat, say, nausea or constipation, should they occur. Remember that if one opioid causes you to have a side effect, it doesn't mean that the other opioids will also cause it. Your doctor may just need to switch to another drug from the opiate family. Also listed here are possible side effects that can happen if you've been on an opioid for many months or possibly years. Notice too the warning about driving. Most people who are stable on an opioid without significant side effects can safely drive. But when an opioid is first started or after a dosage increase, it's wise not to drive or operate dangerous machines until we're sure it's safe. Now, you've heard about the opioid crisis in our country and that deaths have occurred from opioid use and abuse. So let's talk about it. These things can lead to a dangerous situation. If you take more of your opioid medication than is prescribed, it could lead to overdosage and depressed breathing. Always talk to your physician if you feel your medication needs to be increased so that it can be done safely. Secondly, other medications, when added to opioids, can also cause drowsiness and depressed breathing. Be sure to notify your doctor if you consume alcoholic beverages regularly, take anxiety or sleep medication, or muscle relaxants. Refer to your form for some examples. In these circumstances, a serious situation could arise, breathing be severely depressed, and death can occur. It follows that conditions like COPD and sleep apnea could put you at further risk. Your doctor is aware of this and will prescribe carefully. Remember, it's dangerous and illegal to share your opioid medication or seek it outside of medical sources. We ask that you initial the form saying that you won't use substances illegal in the state while opioids are prescribed.
Accidental overdose is a tragic thing. Protect your medication. Leave it in a lockbox if you need to, but do not leave it where it could be lost or stolen, or worse yet, taken by a child or a teenager. This is why we recommend and prescribe a medication called naloxone, which is an antidote to opioids. If you choose to keep naloxone in your home, your nurse will give you more information.
It seems like we've talked a lot about side effects and dangers. Just know that your physician has a plan in mind and will work together with you to prescribe opioids safely. Remember, the goal is for you to feel better without undue risk.
Patients often tell us that they're worried about addiction. Let's talk about that for a minute. When a person has taken an opiate for more than a couple of weeks, something called physical dependence occurs. This is common and expected. It simply means that your body has adapted on a chemical level to having an opiate in your system. If you suddenly stopped taking your opioid without notifying your physician, you could experience symptoms of opioid withdrawal. These are listed on your form. Please talk to your doctor before stopping your opioid so that a plan to slowly taper can be put in place. Now let's talk about addiction, which is a serious but uncommon issue. Addiction is a psychological dependence on opioids or other substances. Persons at risk for addiction may have a personal or family history of addiction or substance abuse, including alcoholism, illegal drugs, or prescription drugs. Understand that addiction is a serious issue. Your healthcare team may perform a screening to assess your risk. Signs of addiction include the desire to take more medication than prescribed to satisfy a craving, seeking some effect other than pain control, or attempting to obtain medication on the street or from more than one doctor.
As doctors, we try to monitor things closely. Your doctor may request periodic urine drug testing. As it says on your form, lost or stolen medications may not necessarily be replaced by your doctor. We take these events seriously. Please try not to call for refills on the weekend, as that is usually not possible. So plan ahead, recognize when your medication is getting low, and notify the nurse during office hours. We don't want you to run out. As we work together to help you feel better, good communication is important. Call your physician's nurse with periodic updates on how you're doing. Remember, when opioids are started, physicians begin with lower doses and work up to a more effective dose. Good communication during this time is important. Your doctor will also be scheduling regular follow-up appointments even after your symptoms are well controlled. As Dorothy mentioned, other therapies may also be recommended for you. If these turn out to be beneficial, your doctor will want to gradually reduce your medication to the lowest effective dose.
Please complete the form by initialing in all of the blanks and signing on the back. And make sure that you get all of your questions answered today.
We hope that this has been helpful and that soon you'll be feeling a lot better.